Good day everyone, I am Leopold'S from BSN Tuli, and I'm here to perform Leopold'S maneuver, fetal heart rate auscultation, and Fundic height measurement. For the assessment, you need to determine the need for Leopold'S maneuver, assess the client's overall condition, and determine when the client last voided or last tested for urine analysis. You also need to determine for the client's immunization history, if there is a history of abnormal fetal presentation in the family during pregnancy, and the last menstrual period and the expected date of confinement. Next is the planning, and for planning, allow adequate time to prepare for the procedure. This must be performed during an antenatal checkup. For the equipment and supplies, you need stethoscope, measuring tape, draw sheet or top sheet, and antibacterial hand spray. For the implementation, you need to check the physician's orders to verify the procedure. Before performing the procedure, introduce yourself and verify the client's identity using agency protocol. You need to explain what you are going to do, why is it necessary, and how they can cooperate.
Good morning, Mrs. De Guzman. I'm Julia B. Santiago, your student nurse from 8 a.m. to 5 p.m. and I'm going to perform Leopold'S maneuvers, which means I'm gonna be placing my hands on your stomach to figure out the position of your baby. Is that okay?
Yes.
And I will also measure the fundic height and auscultate your fetal's heart rate.
Provide for client privacy. Ask the client to empty her bladder before the procedures.
Mrs. De Guzman, did you empty your bladder before I came?
Yes.
Okay, let's proceed.
Okay.
Perform hand hygiene and observe appropriate infection control procedures. For obtaining fundic height, position the client on a dorsal recumbent position, then place a pillow under the client's head for comfort. Place a rolled small towel or pillow on under the client's right hip, and ask the client to be still with arms on the side. Drape the client with the draw sheet, exposed from the below the breasts to the symphysis pubis. Inspect the client for the following: scars, diastasis recti, hernia, linea nigra, striae gravidarum, contour of the abdomen, state of the umbilicus, and skin condition. Determine the fundic height using the ulnar side of the palm. Measure the fundal height using the measuring tape. Place the zero lines of the tape on the superior border of the symphysis pubis. Stretch the tape across the abdomen's contour to the top of the fundus along the midline. explanations given earlier.
You should relax your abdominal muscles and breathe slowly. I will perform Leopold's maneuver.
Use the flat palmar surface of the fingers and not fingertips during palpation, and keep the fingers of the hands together. Apply smooth and gentle deep pressure as firm as necessary. And now, perform the Leopold'S maneuver.
First maneuver. Second maneuver. Third maneuver. And fourth maneuver.
Nakanya, nasabyungsan na. Nasaan ka ba? Wala naman akong nararamdaman.
Place the bell side of the stethoscope chest piece on the fetus's convex portion, closest to the anterior uterine wall. Listen by pressing in firmly and very gently. Count a full minute holding the stethoscope chest piece while the other hand feels for the client's radial pulse. For the evaluation and documentation, document the procedure, including the test performed, and resulted in the client record using forms or checklists supplemented by narrative notes when appropriate. Notify the healthcare facility responsible regarding the results. Inform the client regarding the findings. Perform a detailed follow-up based on the findings that deviated from expected or normal for the client. Teach the client how to do proper follow-ups and provide other appropriate instructions.